Are you wondering whether omeprazole is the right medication for you? This medication does have some side effects, especially if used for a long time. This video will examine the drug omeprazole, educate about side effects, especially in older adults, and tell you what signs to look out for, which are potentially deadly. Coming up. Welcome to Think Your Health. On this channel, we'll give you tips and advice as well as educate you about health-related medical concepts to promote healthy aging. And if you are new here, consider subscribing. Next, we're going to look at the 9 most common questions regarding omeprazole, including the drug's most common side effects. So what is omeprazole? Omeprazole belongs to a family of medications called proton pump inhibitors, PPI for short. Omeprazole reduces the amount of acid in your stomach. What is it used for? For up to 4 to 6 weeks to treat heartburn and other symptoms that happen with GERD, also called gastroesophageal reflux disease. GERD happens when acid in your stomach backs up into the tube called the esophagus that connects your mouth to your stomach. The most common symptoms associated with GERD are burning in your chest or throat, burping, or sour taste. It can be used up to 8 weeks to heal acid-related damage to the lining of your esophagus. This is also called erosive esophagitis and can be also used up to 8 weeks for healing stomach ulcers. It's also used up to 8 weeks for the healing of duodenal ulcers. And the duodenal area is the area where the food passes when it leaves the stomach. These ulcers are sometimes associated with long-term use of NSAIDs. NSAIDs can irritate your stomach lining and duodenal lining as well. Omeprazole is also used with certain antibiotics to treat an infection caused by a bacteria called H. pylori to help eradicate this bug. The infection needs to be treated to prevent the ulcers from coming back. For the long-term treatment of certain conditions where your stomach makes too much acid, such as a rare condition called Zollinger-Ellison syndrome. So how does omeprazole work? Acid is produced by proton pumps in your stomach, and proton pump inhibitors work by turning off and blocking these pumps, thus reducing acid production in your stomach. So how should I take the drug? Take the drug exactly as prescribed by your provider. Do not change your dose or stop omeprazole without talking to your doctor. I'll explain why later in this video. Take omeprazole at least 30 to 60 minutes before breakfast. Swallow omeprazole capsules whole. Do not crush them. Do not chew them. If you have trouble swallowing the capsules, you can carefully open up the capsule, mix the pellets with a tablespoon of applesauce, and swallow with water. Hi everyone, and if you're finding value in this video, don't forget to like, comment, and smash that subscribe button. Can I stop the drug without my doctor knowing? Do not stop taking omeprazole without talking to your provider. What might happen is that you might get rebound acid hypersecretion. And in this condition, there's a reoccurrence of symptoms after stopping the PPI therapy due to an increase of gastric acid secretion even above pre-treatment levels. Omeprazole should be prescribed at the lowest dose and for the shortest duration for the specific medical condition. It is never intended for lifelong treatment so as to minimize side effects. If you've been treated for a longer period of time, let's say up to about 6 months, I would advise you to taper the dose by 50%. So if you're on 40 milligrams, then I would taper you down to 20 milligrams. If you are taking the medication twice a day, then I would reduce it to once a day. So if you were on 40 milligrams twice a day, then I would continue at 20 milligrams once a day for about 2 weeks. Once the lowest dose of the drug is reached, then you can discontinue the drug. Sometimes if you've been on the drug for a lengthy period of time, I would give the drug every other day for about 2 weeks and then discontinue. What other drugs can affect omeprazole? Clopidogrel, it can decrease the activation of these drugs. Antibiotics such as clarithromycin, amoxicillin or rifampin, antifungal medications, methotrexate, which is a immunological drug or rheumatological drug, phenytoin, which is an anti-seizure medication, diazepam, which is also called Valium, St. John's wort, and a blood thinner called warfarin. What are common side effects? Nausea and vomiting, bloating, constipation, diarrhea, or GI side effects, headache. What are serious side effects, especially with long-term use? If you have any of the following side effects, tell your doctor right away. Symptoms such as an unusually fast heart rate, a slow heart rate, or even palpitations, muscle spasms that do not go away, seizures. All of these could be signs of a low magnesium level. In fact, a very low magnesium level could lead to a condition called Torsades, which can be fatal. If you have a rash on your cheeks and nose, joint pain that is getting worse, these could be all signs of lupus. Tell your doctor right away if you develop the following symptoms: persistent diarrhea, abdominal pain or cramping, fever, blood in your stool. This medication may rarely cause a severe intestinal condition called C.Diff. or Clostridium difficile associated diarrhea due to a type of bacteria. And if you have the following symptoms such as unusual weakness, especially of the lower extremities, so tongue, numbness, tingling of the hands and feet, all of these could be signs and symptoms of B12 deficiency. Especially if you use proton pump inhibitors such as Omeprazole daily for a longer period of time, at least for more than 3 years. If you have symptoms such as rash, itching, swelling of the tongue, mouth and face, difficulty breathing, swallowing, all of these signs of allergic reaction, you need help right away. Long-term PPI use can decrease bone density, also called osteoporosis. The FDA has warned about possible increased risk of fractures of the hip, wrist and spine. Long-term PPI use has also been associated with an increased risk of chronic kidney disease, CKD progression and end-stage kidney disease. However, how this happens is not known. PPIs can also cause interstitial nephritis, and signs and symptoms are fever, rash, blood in the urine and confusion. You can treat this condition by stopping the offending medication, which would be the PPI. Obviously, this is not a complete list of possible side effects. If you notice any other effects which are not listed, please contact your pharmacist or your doctor. What about the use of omeprazole and PPIs in older adults? Current recommendations in older patients is to avoid scheduled use for more than 8 weeks, unless for high-risk patients or patients with certain medical conditions such as erosive esophagitis or Barrett's esophagitis, for example. Especially in older adults, there's an increased risk of fractures and C. difficile associated colitis. Some studies have shown an association between the use of PPIs, especially long-term use of PPIs in dementia, but other studies have not found an association between long-term use of PPIs and cognitive decline, so the jury's still out. Here's a bonus section. When does the drug start working? It starts working within an hour of dosing, with the maximum effect occurring within 2 hours. It can last up to 72 hours. How long will it take to restore my gastric acid level after stopping the medication? Acid levels return to previous levels within 3 to 5 days of discontinuation. So question of the day. Did you know that omeprazole and other PPIs can cause decreased bone density and increase the risk of bone fracture? Were you surprised it can affect your B12 levels and magnesium levels? Leave your comments and answers in the comment section below. Thank you for checking out this channel. Don't forget to like, comment and smash the subscribe button. And if you can't smash it, at least touch it or push it. And if you want to see more videos, you can click up here, or click down up here, or click down here, or click down here. Have a good day. Bye-bye. No one's listening. This is a bonus tip. So if you have a lot to eat, like let's say some soda, or some cookies, or some bars, pop in a PPI, or pop in omeprazole. You feel better.